Hi, I'm Mireya, I'm Kinestica's product trainer, and today I'm going to show you Bimeo, which is our system for gamified neurological rehabilitation of the upper limb. Okay, the system is a modular sensor-based system. These would be our sensors along with the pads that you see on the table. And what I'm going to show you now is how you can use the different components of the device to configure different modes of therapy. So if we were working with a patient that is starting their rehabilitation with very limited movement, we could start doing a bimanual therapy on the support surface. For that, I would attach this here for my less affected side, and this, which is the main sensor, would go on the opposite side. So we are working under the assumption that my left side is the most affected side, for example, in the case of a stroke. These sensors would be placed on my hand. So this one would be placed on the wrist, and this one would be placed on the upper arm right above my elbow. We could start working bimanually on the support surface. As the patient progresses, we could move on to working unimanually on the support surface. So we would just attach these two and work in this way. Then, when the patient can lift the weight of their arm, we can move on to working bimanually in the free space. So in this way. And unimanually in the free space once they no longer need the help of their other side. Additionally, we have two more modes. One of them is what we call the support sphere mode. So we would use all of the Bimeo components and we would place this over here. Our hand would be placed on top of the system. My elbow would be supported on the pad or on the regular table. And then we would be able to do training of the full range of motion of the wrist. If we wanted to target isolated joints, so the wrist, elbow, or shoulder separate from each other and targeting their specific movements, so for example, pronation, supination of the wrist, we could also do that. And the system would take care of making sure our patient is not controlling for compensations. So if I wanted to make the pronation supination movement, but I was actually using my shoulder to compensate the movement, the game on the screen will not actually read that movement as correct and won't let me complete the game.